Welcome. Well, food's a big deal, right? And food is confusing today. There's like every kind of dietary recommendation on the internet, right? And it's very confusing because every doctor has a bibliography, there's testimonials. What do you believe? Is it carnivore, low carb? Is it keto, high fat? Is it plant-based, vegan, vegetarian? Is it a cabbage soup diet? Is it a cookie diet? Is it special meals that you order? It's very confusing, right? I got my start 20 years ago. I was nutritional science biochem in undergrad. I was an athlete. I ran track in college. I was an Olympic bobsledder in 1994. So I thought I understood nutrition. And what do you think I ate as an athlete? Meat, chocolate milk, right? Because chocolate milk is supposed to be a post-recovery drink. Yeah, and so that's what you eat. And so even though I was nutritional science biochem and I went through medical school, how many hours of nutrition did I get in med school? 19. Less than 1% of my total medical education hours were nutrition. And I didn't learn anything that you're going to learn today. You will know more than most physicians today after our 45 minutes today. So, but I was in practice, early 2000s, and my patients kept telling me, Dr. Stoll, I'm falling apart. You ever heard that? And I thought, well, this is just the inevitable consequence of aging. Some people have genetic susceptibilities for heart disease, for dementia, Alzheimer's, for cancer. Lifestyle has some contribution. You smoked, you drank, this is just what happens. And that's why medicine is here. So we can diagnose you and prescribe a medication to help improve those symptoms. And what I didn't realize is that that really wasn't helping people. There was a day in my practice, a woman said, Dr. Stoll, can you help me? I'm falling apart. She had a long past medical history list. And so I just asked her a question. I said, what does falling apart actually mean to you? And I was like thinking ahead, like which problem do I need to address in the next 10 to 15 minutes? And after a long pause, she said, my marriage is falling apart because my husband is just so tired of taking care of me. Now she had my attention, right? She said, I can't travel to see my grandchildren because I can't fly to Washington. It's 3.5 hours away. We're facing financial bankruptcy because of the cost of my health care. I'm depressed. I don't have any friends. I can't attend church. And with tears running down her cheeks, she said, can you help me? And I started to think back on all of my lectures in medical school, all of my residency years, and I had no answer for her. I didn't know where disease came from. What's the origin of disease? I understood the pathophysiology, the receptors, the way medications worked, but I didn't understand where disease came from. I didn't know if it was possible to suspend and reverse disease. And in that moment, I realized that the diseases on her past medical history list were undermining everything meaningful in her life. Like quality of life was being undermined by these diseases. That I had been effectively trained to diagnose, prescribe medications, order MRIs, interpret imaging, do procedures, but nobody taught me how to truly help somebody put their life back together again. So it sent me on a personal learning journey. And I started reading diet books because I thought certainly one of these doctors has a solution. So I read Atkins to Zone and everything in between. And when I finished, I was more confused than when I started. Just like most people in America, right? And is it simply calorie counting? How many people like to count calories? No. Who wants to do that for the rest of their life, right? That's miserable. Is it, ordering special cookies, meals that come to your house? It's impossible to do those things, and that's why we have such a problem today, because nothing is sustainable, nothing's continually doable, and it doesn't really make you feel that much better. And it's very confusing. So I came to this conclusion as I was doing more and more research and spending time with some experts around the country, that it's more plants, healthier body. Not rocket science, right? More sleep, more activity, less stress, healthier body. This is not, but somehow we all know that intuitively, right? We should eat more plants, we should get more activity, we need to sleep 7 or 8 hours a night, we shouldn't be stressed, and we need more, healthy connections in our life. But our culture is working against us, as I'll describe later today. The culture is actively around us, purposefully undermining our lives and our health. Because as my grandpa used to always say, Scotty, it's always about the money. When they tell you it's not about the money, it's still about the money, right? And I'll help you understand how that works against us today. But it led me to understand that plant-based plates are powerful. And so I started in my practice using my prescription pad to write breakfast, lunch, and dinner for my patients and smoothie recipes that we're using at home with our family. And I saw radical transformations, things I didn't know were possible. Diseases reversed, discontinuing medications, discharging patients, happy staff, like, wow, what is happening in my clinic? Shortly thereafter, I was asked to serve on the scientific advisory board at Whole Foods. We started doing health immersions with Andrea and Tom, where we, for 14 years, 2 or 3 times a year, we bring in about 100 of our most unhealthy team members, and we feed them and teach them how to take care of their bodies for a week. And their bodies rebound so quickly that we actually have to hire another doctor to take them off medications. So most people don't know why they're making the decisions they're making. They grew up that way, they live in the culture, so it's not their fault. But this is the way they've lived for 10, 20 years, and they come in with diseases, and we simply change what's on their plate, give them a little bit of exercise, teach them about being healthy, and in 1 week, they're healthier than they've been in 20 years. It's the power of food, right? It's incredible, and 14 years of that have just cemented into me that, you can be so far down the road, but you start making different choices in 1 week, and your health rebounds. By the end of the week, everybody tells us, I haven't felt this good since I was 18. I haven't had this much mental clarity since I was 18. My pain is gone. They feel incredible. Just 1 week of healthy food. We started a not-for-profit organization to educate healthcare professionals, the Plantrician Project. Our table is out there. And we started with a conference in 2013. We had about 180 doctors that came, and it's grown. And so we have a conference in California now, a large one. We helped start a conference in Australia, Saudi Arabia. We'll be starting in Kyoto, Japan, Bangkok, Thailand, UAE, because doctors are recognizing that nutrition is far more important than we ever recognized. And as you'll see today, it's really simple. It's just more plants. This slide, I put it here to just remind us, this study found that 90% of the disease today is related to lifestyle and not genes. Isn't that incredible? So our healthcare budget in the United States is what? $4.1 trillion and continuing to go up. And 80%, at least 80% of the cost of healthcare is related to lifestyle choices that we're making. But our lifestyle choices are influenced by our culture and the industries that are driving our culture. And so lots of people are inadvertently making unhealthy lifestyle choices because it's just the way that we live and grow up in America, but now it's everywhere. And we think that it's genetic that these things happen, but it's a genetic predisposition that really comes from something called the epigenome. Anybody heard of epigenetics? So epi means above. So above your genes is another layer of switches that are turned on and turned off by your lifestyle choices. Not only your lifestyle choices, but your grandparents' and your parents' lifestyle choices. So whatever grandparents, mom and dad ate, drank, exercised, slept, were exposed to, flip these switches on and off that make you more or less susceptible to the family history of diseases. Alzheimer's, cognitive decline, dementia, heart disease, high blood pressure, cancer, all influenced by lifestyle choices. So the good news in this story is that no matter what grandparents, parents did, when you begin making different choices, within 3 months, you are altering hundreds of genes in your body. Flipping off switches that may have been flipped on by unhealthy choices in our parents, and flipping off switches that may have led to diseases that manifest in your future. But it's also part of the reason that we see epidemic levels of type 2 diabetes and diseases in our children today, because parents grew up in this huge food transition that started in the Industrial Revolution, where today, nearly 2/3 of the average diet is ultra-processed food in America. And so their switches have been flipped by parents, so the children are being born today with these heightened sensitivities, and then they grow up eating garbage. And it's why, I have a friend that's a heart surgeon in Texas. He had a 12-year-old that showed up with an acute heart attack. Wow. 12 years old. We used to call it adult onset diabetes, right? Type 2 diabetes, because it happened in adults.
They have a specialty now for child cardiac.
Yes.
Cardiologist. It's a special thing.
Yeah, because of the lifestyle. Because this epigenome is being pre-sensitized, preloaded by the lifestyle choices in our culture and globally today. But I want you to take away the good news is that that can be reversed very quickly. And the research shows that, in 3 months of making different choices, more than 500 genes are positively impacted. And it's more than that because those are only the 500 that we measured. So I want to invite you we're going to just take the next 30 minutes to just talk about food, and I want to invite you to think differently about food. Food is more than eat this, don't eat that, right? Food is very powerful because it's involved in traditions, cultures, family get-togethers, foods that mom and dad made that we used to get together and brought us all together around the common table. It's emotional eating, it's a counselor. It is so many things that is so powerful. The food industry knows that food is powerful and that it works on the receptors in our brain where sugar, fat, and salt work, just like cocaine, methamphetamines, cigarettes, and alcohol. And the food industry went to the cigarette industry to learn about the receptor system in your brain so that they could design food to hit what they call the bliss point. And to get there as fast as possible by layering in sugar, fat, and salt. So as you eat it, you get a hit. Now, when you eat a blueberry or a really good strawberry, you get a small hit of dopamine because that's the way your body's designed. It's supposed to taste good and feel good. But when you eat sugar, fat, and salt and processed food, what happens? It's a massive spike, just like a shot of alcohol. And then you weren't feeling good, and you ate this food, and boom, you feel better, and you look at the label, and you're like, wow, those Pringles really hit the spot. So the next time you don't feel good, what happens? Your brain says, remember how good you felt when you ate those Pringles? And you feel compelled to go to the supermarket or the store and to buy the Pringles because they know that marketing works. Why? Because they've done neuromarketing on brains using functional MRIs to put labels in front of people to find out which label activates the buy button in your brain. And they're working against you because they want to separate you from your money. And so we're caught in this web, right, of knowing we should eat more fruits and vegetables, but caught by this culture of food that we all grow up in and caught by this reward system that's been hijacked by industry. And then we don't have a healthcare system that's there to support us and help us make the right lifestyle changes because doctors don't know. And so most people are suffering. They will spend the last 20% of their lives in poor health. Doctors don't even know where diseases come from. We just know how to manage diseases, and we're looking for drugs to be the solution when the plate is the solution. Hippocrates said healing is a matter of time, but also a matter of opportunity, and the opportunity is changing our lifestyle. And the most important lifestyle factor to change is the food on your plate. So as we rethink food, we think so differently, but we think about food as macronutrients today. Protein, fat, carbohydrates. Most diets argue which of those we should eat more of, right? You should be high protein diet. Why? Why do we eat high protein? What's the kind of general consensus? Why is everybody worried about protein?
It satisfies.
Satisfies you, builds a strong body. Is there a protein deficiency in America? No, we eat too much protein. In fact, what is the leading nutritional deficiency in the world today? Fiber. Only 4% of any age group in the United States gets the minimum basic fiber of 25 to 35 grams. How much fiber should we be eating when you look at the research for health? 70 to 100 grams. So almost nobody in the world is getting what they should with fiber. But we argue protein, fat, carbohydrates because they have calories. We rarely talk about the micronutrients. We talk about vitamins, but how do we get vitamins? One a day, right? One a day vitamin. We don't talk about minerals. We don't talk about antioxidants, adaptogens, all these other things that are the micronutrient content of food. So we're arguing about calories, but really the question we should be asking with our bodies is how are our calories packaged? What comes with my calories? Is it loaded with the micronutrients that support health? Or are we just getting protein, fat, and carbohydrates without beneficial nutrients? Or is our food coming loaded with things that are unhealthy for our bodies, causing inflammation and disease? Here's what's happened over the last 100 years of our food system. We've added 135 pounds of sugar and sweeteners. Now, are we buying 135 pounds of GW sugar in our carts, checking out with sugar? So where's that sugar coming from? It's in the food. And why is it in the food? Because it tastes good, it hits our reward system, and they want you to feel good after eating their food. And so they put it in everything. And if you start reading, there's over 60 names of sugar. And they've done that deceptively. Why? Because they know that most people, if they look in the label and it says sugar, you're like, that's probably not good. But then they include all these other names that are tricky, like maltodextrin and natural sweeteners that are just sugar, but they hide them in the label. And it's there, and that's why we're eating that much. 70 pounds of oil. Why is that an issue? How many calories per tablespoon of oil? 120. And the average person is getting 4 to 5 tablespoons a day, which is how much, class? 500 to 600 calories per day. You know, women should be about 1,500 calories, men 2,000 calories, so that's a third to a quarter of your total calories from oil. I always like to joke that it's lips to hips in 3 minutes, because it's prime for storage, right? It just goes, whew. Your body says, great, we'll store this away right now. So most people, and then you struggle with your, with weight, but really it's this calorie density that's hidden in oil. And it's not that we're eating tons of oil, although if you ask people to measure, how do you measure oil when you're cooking? It's not like tablespoons, right? It's this. So it sneaks up on you, but most of the oil is in processed food. It's in restaurant meals, processed food, so that's where it's coming from. We've added 100 pounds of meat, 30 pounds of cheese. Not cheese, right? Everybody loves cheese. Somebody came up after the last session and said, do I really have to cut back on cheese? Cheese, yeah, and we'll talk about that briefly, but 500 calories and 53 gallons of soft drinks. That's a bathtub and a half full of soft drinks. It's amazing, right? So we're really just talking about which foods do we need to eat more of. Our Western dietary pattern, which is largely animal products and processed food, has these effects on the brain from the research. This is cognitive decline, impacts the hippocampus, which is memory, damage to the blood-brain barrier, which is really important because your blood-brain barrier is designed to protect your brain, but once it gets inflamed, it becomes leaky, and you get inflammatory molecules that get into the brain that cause neuroinflammation, which we'll talk about in a minute. Neuroinflammation, activated microglial cells, which are a part of that cascade in dementia, and damage to the endothelial cells. So other than Andrea, anybody know what an endothelial cell is?
The lighting of the blood vessels.
Very good, James, that's right. So we have 60,000 miles of blood vessels in our body. I have this amazing picture that I'll show you in just a minute. 60,000 miles. On the inside of every blood vessel is a single layer of cells called the endothelial cells. It's like 2 or 3 tennis courts worth of cells. These little cells have a very important job. One, they're the front lines for everything that you eat. Goes into your bloodstream to get to the cells. So everything you eat is bouncing up against the endothelium. When you eat healthy food, the endothelial cells are healthy and they produce molecules that allow for vasodilation, opening the blood vessels to increase blood flow. Prevents platelets from sticking, protects against atherosclerosis, lowers inflammation, protects against cancer. But when those little endothelial cells get injured, they stop producing nitric oxide, they start constricting, you reduce blood flow, platelets start sticking, you develop plaques, you get inflammation in there, it becomes the front line of disease. In fact, when you talk to most really up-to-date researchers in Alzheimer's, ground zero for the development of dementia is what? Blood vessels. Once the blood vessels begin to get injured, then all the downstream effects of buildup of tau proteins and everything else happens after the injury of the blood vessels. But if we go back one step further, what causes the injury of the blood vessel? Our diet and lifestyle, right? So thinking kind of in a string, so we can begin to solve the problem at the highest upstream point. This is just to review some of the more recent studies, just to show a trend that more fruits and vegetables, lower rates of dementia. That's 2024. School gardens increase fruit and vegetable intake in children, and it improved their school performance. Because the research shows when kids are involved in growing food and even cooking food in their own kitchen, they will eat more of it. You can serve them broccoli and they're like, I don't want to eat that. But if they grew it and if they help prepare it in the kitchen, they will eat it. Inverse association between vegetable intake, so more vegetables, healthy gray matter in the temporal region. Increased fruit and vegetable intake changed the microbiome. What's the microbiome? Anybody know? We have billions of bacteria that live in our gut that are actively involved in our health. In fact, more than 75% of the health of your immune system is based upon the health of the bacteria that live in your gut. And the health of the bacteria are directly impacted by fruit and vegetable intake, the fiber that feeds the healthy bacteria. They also produce neurotransmitters like serotonin for the brain and GABA. And so when that microbiome is healthy, it impacts the entire health of your nervous system and your body. So this study showed more vegetables, healthier microbiome with lower inflammation and preservation of brain tissue. And it really goes back to just changing what's on our plate with more fruits and vegetables. I love the title on this one, Let Us Be Happy. This is a long-term longitudinal study looking at the relationship between fruit and vegetable intake and well-being, partially because of reduction of inflammation in the brain. But what's important here is they showed a dose-response fashion to the quantity and frequency of fruits and vegetables consumed. So mental well-being improved with every single serving of fruits and vegetables. So the good news for people is that every time you add a serving of fruits or vegetables, there's benefit. There's benefit. So it's not like you have to be 100% one way or another as people are making a life transition. Every single serving has an impact, especially on well-being, and part of that is because of neuroinflammation. And inflammation is not just affecting the brain. The studies show that it's impacting every one of these diseases. And you can see from neurologic diseases to cardiovascular diseases, chronic inflammation is one of the root causes. But again, going back upstream, what's the source of chronic inflammation in our bodies? Our diet, largely. How many pounds of food do you eat in a year? Do you know? 2,000 pounds of food. If you see a little Chevy Volt on the road, that's about 2,000 pounds. So you're eating bumper to bumper every single year of food. And if we just stop to think for a minute, the impact of 2,000 pounds of food passing through our bodies, going into our blood vessels, impacting our endothelium, turning on and off switches, promoting or reducing inflammation, that 2,000 pounds becomes one of the highest level impact things that you can do for your life. Just simply paying attention to what passes through your body. But when we begin to make different choices with our diet, then inflammation goes down and it protects you from all these diseases. It turns off that epigenome, all those switches that may be a part of these diseases. So even if you were born with a high susceptibility for Alzheimer's, Parkinson's, MS, cardiovascular disease, when you start making the right choices, it'll turn off the switches and you may never have to, that'll never manifest in your life because you've changed the 2,000 pounds of food or the 100 bites that you eat on a daily basis and transformed your physiology. And then just continuing on with the inflammation, this study again shows that higher dietary inflammatory index scores are associated with aging of the brain. It's called inflammaging. So as we eat, our brain becomes inflamed and our cells age more rapidly. And that inflammaging that is associated with 27 different diseases. So it's the message is that not only does diet impact our brain, protect our brains against dementia and Alzheimer's, but it protects every one of these areas. Autoimmune diseases like rheumatoid arthritis, cancer, cardiovascular disease, blood pressure, inflammatory bowel diseases, irritable bowel diseases. Everything is impacted by what we eat, and it drives that inflammatory index. But the good news is, when we make a switch and we change what's on our plate and we begin eating beautiful salad with blackberries and greens, they have antioxidants and phytochemicals. And so within 2 to 4 hours, this is the wonderful message of food. Within 2 to 4 hours of eating food, it's found its way all the way down to the DNA level of your cells. It is turning off those switches, and it is turning off these genes that are involved in inflammation within 2 to 4 hours. But also, it's not just the colors and the phytochemicals, but the fiber in the food is broken down by the microbiome in your gut. And the microbiome, the little bacteria, produce a byproduct like butyrate that also turns off inflammation. So it's like through multiple channels that your body is finding its way to health and reducing inflammation because you've chosen to put plants on your plate. Does that make sense? Mm-hmm. It's such a good news. It's not like you're taking a supplement to try and reduce inflammation, but when you just change your plate and you have a delicious meal of plant-based plate of food, you're turning off switches in multiple ways in your body. There's a good study that just highlights the power of those antioxidants. They had a group that ate dark-colored fruits and vegetables versus light-colored fruits and vegetables. And they found that in just 2 weeks' time, the group that ate dark-colored fruits and vegetables lowered their antioxidant, their inflammatory levels, versus the group only eating light-colored fruits and vegetables saw an increase in inflammation over the course of 2 weeks. Because it's the phytochemicals, the colors, and the antioxidants that make a difference. And it makes a difference in the brain by reducing neuroinflammation. So those antioxidants like sulforaphane in broccoli, resveratrol in grapes, curcumin and turmeric, if you've made a wonderful curry dish with grapes on the side for dessert, comes up and you start, again, turning off all of these inflammation levels, lowering inflammation in the brain, and protecting your brain from that long-term damage or the accelerated aging that can occur because of the dietary choices. And it also, the fiber, again, produces that butyrate. And look at all, I'm not going to go in detail, but look at all the genes that are transformed when you make a different choice in your body. The bacteria produce that short-chain fatty acid that turns on and off all these genes involved in diseases like cancer, inflammation, cancer, insulin resistance, cardiovascular disease, the brain. It upregulates the brain-derived neurotrophic factor that grows more brain cells. All these things are activated simply by making a different choice. And that microbiome that produces butyrate is positively or negatively impacted by our lifestyle. Incidentally, what is the #1 source of antibiotic exposure in the United States? Is it the doctor's prescription pad? Animal agriculture. 80% of the antibiotics that are produced are used in animal agriculture because they're stressed and unhealthy. They used to be used also to help grow the animals faster. So by the time meat reaches the supermarket shelf, it's been exposed to antibiotics 60 times now. So it's the leading cause of antibiotic resistance in bacteria and now fungus. And it contributes to decimating our gut microbiome because we're exposed to those antibiotic residues too. And when we have a healthy gut microbiome, it impacts our brain because there's a gut-brain axis. And just to not to look at it for what it is, but how does that feel when you see that kind of food? What's the feel, right? It's nice. And when you think about Western diet, which we'll show in a minute, it has a totally different look and feel because your body craves this food. It's full of energy and life. So there's the blood vessels. Isn't that amazing? 60,000 miles of blood vessels. So what's good for the brain is good for the heart, which is good for the discs in the back, which is good for wound healing. It's good for everything. Erectile dysfunction in men, everything comes down to what we eat and how it impacts our vascular system. And these are all the diseases that are related to unhealthy vascular dysfunction. And so, but what impacts vascular health? Leading is food. The 2,000 pounds of food that you eat in a year. Food, exercise activity, a good night's sleep, stress reduction, all goes back to the same basics, but you have healthy blood vessels throughout your body that are increasing blood flow to every part of your tissue and bringing in the nutrition that your body needs to optimize that function. And these are those little endothelial cells. You're going to leave today and be able to share this over lunch, like ask your friends and family, do you know what endothelial cells are and how important they are in your health? So these are that single layer of cells lining your blood vessels that are important in every part of your life, and this is what happens when they get damaged. They get inflamed, the platelets start sticking, you get cholesterol that oxidizes and stays there, and incidentally, why do we get cholesterol in our arteries? You ever wonder that? Why do arteries clog? We're told that it just builds up, but why does it build up? Because cholesterol is a part of every cell membrane. And so when you get cell damage, your body sends cholesterol to the area because your body is trying to repair and rebuild cells that have been injured. So the cholesterol is there for a reason, to rebuild cells. But breakfast, lunch, and dinner, Egg McMuffin, quarter pounder with cheese and fries, and pizza for dinner causes 3 times a day damage there. So you have cell damage going on. Your body's bringing cholesterol to repair. You get sticky platelets, vasoconstriction, lack of blood flow, and we develop plaques to the discs and everywhere in our body, including the brain. And from the research, this is what contributes to damaged endothelial cells. Tobacco, sugar, saturated fat, stress, environmental toxins, elevated cholesterol, inactivity, unhealthy lifestyle. Is there any safe level of alcohol? Is alcohol healthy?
They had 1 glass of wine, actually, with that.
So they used to think so. Then they came up with a new way to actually go back and study, and they found that there's no safe level of alcohol. They used to think that the resveratrol in wine was an antioxidant, would be beneficial, but what they found when they go back and look at the study is that any exposure to alcohol causes damage to your body, brain, heart. 2 alcoholic beverages a week can dramatically increase the risk of breast cancer for women. So the problem in healthcare is that we think about things in a reductionistic way. We're like, well, a glass of wine is good for your heart. Well, a glass of wine might, it's not good, but they thought it was good for the heart, but it's definitely not good for the brain, and it's definitely not good for your cancer risk. It's not good for your microbiome or the bacteria that live in your gut. So it's never healthy, but we think about it through the wrong lenses. So there is no safe level of alcohol. If you want to have an alcoholic beverage, you can do it, but don't convince yourself you're doing something for your health. Just enjoy it occasionally, and that's it. And then go have a smoothie in the morning. This is from the Journal of American College of Cardiology. It's just to highlight that just like the brain can have neuroinflammation, the same thing in our blood vessels, we have aging of our blood vessels. And it is related to the same things that we talked about, and the same things, the healthy lifestyle with more fruits and vegetables lowers the vascular age. And these are the things that have been shown in the research to create a healthy endothelium. My friend started the Angiogenesis Foundation, which looks at healthy endothelium and blood vessels, Will Lee, and they did a study to identify all of the foods that are healthy for your endothelium. And this is the research they produced. It's basically plants, right? Greens and beans and cauliflower and Brussels sprouts, broccoli, onions, garlic, turmeric, and spices, mushrooms. The more you eat, the better. And we know that spices are healthy and great ways to improve the health of our brain, and adding them in any way protects against dementia and improves blood flow to the brain. You can't outrun a bad diet. A lot of people think you can exercise away because you're burning calories, but this study looked at marathon runners, and they have high degrees of atherosclerosis. Why would that be? They're running, and they're thin, but 3 times a day they're eating food that's injuring their endothelium, causing damage and the formation of atherosclerosis. So the message is the core for health is nutrition. Yeah. Exercise is important, but it really is nutrition. 2 quick slides to show again that it's lifetime exposure to high cholesterol that has the greatest risk of developing Alzheimer's. High cholesterol during midlife, 57% higher risk of developing Alzheimer's disease. But where does high cholesterol come from? Western diet. And again here, higher saturated fat intake, Western diet, faster memory decline by 70%. And so what is saturated fat? It's what most people eat today, right? And think about this compared to the picture of the fruits and vegetables. Some people look at that and they say, wow, that looks really good. I'm hungry right now. Lunch is coming up, right? But the look and feel is very different. That may be like hunger and craving, but the other one felt like life. And that's what it does in your body. Lifestyle factors make a difference. 4 to 5 lifestyle factors, 60% lower risk of Alzheimer's and dementia. So the more often we practice healthy lifestyles, the lower our risk. I'll just skip forward because we're almost done here. This is just, again, to show that it's our culture that is really driving. And part of the solution for us is not just recommending lifestyle, but to start creating healthy culture and community around us to support people making healthy lifestyle choices. Because this is what they're fighting every day. And it's powerful. It is very powerful. So on average, how many servings of fruits or vegetables should you get?
4 to 6, I think.
So that there was great, powerful messaging, right? 5 per day. What percentage of people know that? 90% of people know it. How many people are actually eating 3 to 5 servings of fruits or vegetables in a day? What do you think?
4%.
10%. So we know it, but we don't do it. How many should we be eating? And this is for, optimized health, for prevention of cardiovascular disease, which is also brain health, cancer, premature mortality. And if we did that, reduction of 7.8 million deaths globally.
If you recommend 10 servings of fruit, what about the diabetes?
Well, this is fruits and vegetables, right?
Okay.
But yeah, we'll talk about that in the Q&A. Here's another one. Cardiovascular risk again, 800 grams, 10 servings. And the more that this comes out, athletes should be eating 12 to 14 servings a day to maximize their performance. So it seems like a lot, but that's what delicious food looks like. And part of the reason we do this too, I do this for the next generation. Because this generation is really suffering right now. Kids are struggling in school. Kids have weight problems, type 2 diabetes, heart disease, asthma. They're on medications. They don't feel good because they're growing up in an unhealthy culture. Maya Angelou said, I did then what I knew how to do, but now that I know better, I do better. And so we're on a mission to educate people so that we can do better, because most people just don't know. They just don't know, because this is what our culture has taught us. But we have to do better because we're handing off the world to this generation, and we want them to be prepared to step into a healthier lifestyle and healthier world. Several big studies have come out in the last number of years that it's at least 10% less to eat a plant-based diet than a traditional Western diet. And it can be up to 20% less for some people. You're absolutely right. Just a couple of quick resources. Plantrician Project's out there. Come see us. We started with a conference. We started a university this last, or 2 years ago, to educate every healthcare professional, student, and faculty member. It's a free platform where anybody in any healthcare education can learn for free. So if you know somebody, send them there because we want to teach them. We have a free journal, International Journal of Disease Reversal and Prevention, you can find. We started a Culinary RX, which is a basic education for cooking healthy food, because we found people don't even know how to cook oatmeal or steam vegetables or use a knife. So you got to start somewhere. We started a health equity conference. Our conference was just this year in Huntsville, Alabama. We'll be down here next year because we want to solve the problem for those communities. And we work with Rodale.
We are so grateful for Dr. Stoll's presentation. We take this opportunity to emphasize some of the very important points in his presentation. Dr. Stoll has made the case for believing that, when it comes to our overall health, we are what we eat. At Alzheimer's Community Care, we are privileged to provide care and services for patients with Alzheimer's disease or a related disorder and their family caregivers. Our day center participants are in various phases of middle stage disease. While modern medicine has not yet produced a cure or even a treatment that stops or reverses these disorders, our day centers provide therapeutic, engaging cognitive and physical activities that do appear to slow the disease process. At the same time, we provide community and professional education on what we can all do to prevent or delay symptoms of cognitive and physical decline. Dr. Stoll has provided the evidence as to how diets high in inflammatory, processed foods put us at risk for a wide variety of diseases and for cognitive decline and Alzheimer's disease. While there are now many experts in neurocognitive disorders echoing the importance of lifestyle choices, specifically diet, exercise, and socialization, we would like to share the many other strategies that we advance as protective for heart and brain. This is a list of lifestyle strategies believed to help protect and preserve brain health. While Dr. Stoll has focused primarily on diet, physical activity, and avoiding alcohol, we take this opportunity to talk about some additional strategies. It seems logical that the more protective strategies one adopts, the more protection afforded. Let's explore some of these approaches in more detail. These healthy strategies are called primary prevention. That is, all we can do to protect heart and brain health. Smoking is harmful to those who smoke and to those exposed to secondhand smoke. Smoking is a major factor in cardiovascular disease. Smoking can lead to blood clots that can block blood supply to the heart, causing heart attack, or the brain, causing a stroke. Smoking can lead to high blood pressure, which can also damage blood vessels, leading to blood vessels becoming thickened and narrowed. Sleep quality is also vital to brain health. Deep and dream sleep offer the brain an opportunity to flush out toxins. A chronic lack of this restorative sleep can lead to buildup of beta amyloid protein, a factor in the development of Alzheimer's disease. The general recommendation is for 7 to 8 hours of sleep each night, with about 20% of the time in deep and dream sleep. There are many strategies for improving sleep. These include having a regular sleep-wake schedule, avoiding caffeine and alcohol, avoiding using electronic devices before bed and keeping them away from the bed, and keeping the bedroom dark and cool, among others. Responding to stress in a healthier way also impacts brain health. Chronic stress can cause the body to produce too much cortisol, which can lead to inflammation. While we may not be able to change the incoming stressors, we can change how we respond. Identify what triggers your stress and make a plan to minimize the impact of those triggers. Learning new things can help the nerve cells of the brain, the neurons, to make new connections and may even help grow new neurons. You may choose to learn a new language, a new hobby or skill, a new type of puzzle or game, or a musical instrument, which can even be plastic. Staying socially active can stimulate memory and attention. This has led to research findings that people with strong social engagements are less likely to decline cognitively than those who are only most of the time. Using your non-dominant hand for everyday tasks makes both sides of the brain work. This challenge to the brain can lead to an increase in both creative and flexible thinking. Maintaining dental health helps to prevent gum disease, which is now associated with the development of vascular dementia and Alzheimer's disease. Daily flossing and twice-a-year professional dental cleanings can prevent or reverse gum disease and reduce or eliminate these risks. Stay current with vision exams. Ensuring that you have optimal correction for any vision problems helps the brain to continually process and perceive new information. Optimal vision also supports the ability to remember. Address hearing loss by seeking a hearing evaluation by an audiologist. Untreated hearing loss can lead to cognitive decline by reducing the amount of information reaching the brain, which results in less brain stimulation in the areas responsible for language and memory. Take the opportunity to just do nothing, at least a few minutes each day. This meditation, whether it lasts just a few minutes or lasts an hour, such as in a yoga class, can boost memory, learning ability, and cognition, ease stress and anxiety, improve sleep, and produce other benefits. Finding your purpose in life is important to preventing or delaying cognitive decline and reducing the risk of Alzheimer's disease specifically. Lastly, have your annual primary care physical exams. Request cognitive screening at those exams. Recent advances in research have benefited those with early-stage cognitive changes. Early intervention leads to the best possible outcomes. The number of experts who are advancing the benefits of plant-based or Mediterranean-style diets and the many other protective lifestyle choices is growing. Here is a list of some of these experts and the books they have published on this subject. We are so pleased to list Dr. Stoll's book, which illustrates stories of several dozen patients who reverse their chronic diseases. The list of reversed diseases includes type 2 diabetes, heart disease, and obesity, all risk factors for Alzheimer's disease. Doctors Agronin and Kosick have been presenters at previous Alzheimer's community care education conferences. Dr. Agronin's book focuses on the importance of purpose and how adults can reinvent their lives and achieve creative aging through the wisdom earned with aging and a positive outlook and purposeful attitudes. Dr. Dale Bredesen describes how the various heart and brain healthy lifestyle strategies can enhance cognition and even reverse decline. The evidence for how lifestyle choices help to protect heart and brain health is compelling. Most recently, the CNN documentary The Last Alzheimer's Patient showed the remarkable improvements in patients diagnosed with Alzheimer's disease when they embraced plant-based diets, regular exercise, and structured socialization. Dr. Dean Ornish appears in the documentary profiling a patient with early-stage disease whose symptoms appeared to reverse over 5 years. Dr. Ornish discussed how heart-healthy lifestyle strategies also benefited the brain, and how these approaches can reverse type 2 diabetes, high blood pressure, and heart disease. As these conditions also contribute to the risk of developing Alzheimer's disease, the benefits of heart and brain healthy strategies cannot be overstated. This documentary can be viewed on Max. Dr. Sanjay Gupta is featured in the documentary. He discusses how he sought cognitive screening because of his family history of Alzheimer's disease. In his book, Keep Sharp, Build a Better Brain at Any Age, Dr. Gupta also explains the many strategies that can help to protect and preserve brain health. Dr. Richard Isaacson of Boca Raton, also featured in the documentary, echoes the advocacy of Alzheimer's community care in considering cognition a vital sign measured on a regular and standard basis. He says, "We get a cholesterol test every year and check your blood pressure. You have to do the same thing for the brain." Dr. Kenneth Kosick, in his book Outsmarting Alzheimer's, What You Can Do to Reduce Your Risk, says we can outsmart the genetic risk for the most common type of Alzheimer's disease using SMARTS. S stands for socialization, M for meal smarts, adopting a plant-based diet or at least avoiding highly processed foods. A stands for aerobic smarts, remember the 2.5 hours of exercise each week. R stands for resilience smarts, which refers to finding healthier responses to stress. T stands for train your brain, challenging your brain to learn new things that we mentioned earlier. The final S stands for sleep smarts, ensuring you get the restorative deep and dream sleep we discussed earlier. Dr. Dean Ornish, in his book Undo It, How Simple Lifestyle Changes Can Reverse Most Chronic Diseases, echoes the same advice. We have so many experts weighing in on how the healthy lifestyles we have reviewed can protect heart and brain health, and the evidence shows that people with a diagnosis of Alzheimer's disease can achieve marked improvement. While research continues in the search for a cure, or for a safe, truly disease-modifying treatment, it makes sense to adopt as many of the healthy strategies as possible. These strategies involve no drugs and have no dangerous side effects. Of course, the earlier a neurocognitive disorder is diagnosed, the more improvement one can expect. Early diagnosis is dependent on screening. Screening for cognitive impairment is neither standard nor routine in primary care settings. Alzheimer's Community Care created this logo with a goal of inspiring standard, routine cognitive screening, just as the other vital signs, such as pulse, blood pressure, respirations, temperature, and pain, are routinely assessed. We have readily accepted screening for so many conditions: diabetes, high blood pressure, breast, colon, cervical, prostate cancers, and more. With screening, conditions can be identified early when they are most treatable. Over recent decades, so many conditions that were often fatal are now successfully treated when identified early, with a quality of life and lifespan preserved. Alzheimer's Community Care advocates for this same principle to be applied to brain health. Why is emerging cognitive impairment so often missed in the primary care setting? A recent publication noted 4 main themes for this phenomenon. Primary care providers hesitate to discuss brain health and cognition. Patients hesitate to mention concerns about their cognition. Guidance for healthcare providers for developing treatment plans for cognitive decline is not communicated well. Social and cultural context for cognitive impairment affect perceptions of cognition and brain health, affecting clinical discussions with patients. In 2019, the Alzheimer's Association published its annual Alzheimer's Disease Facts and Figures report. In this report, results of a survey of 1,000 primary care providers was displayed. Here are their responses about information that would be helpful in assessing cognition. 950 of these 1,000 physicians said information on which assessment tool to use would be helpful. 940 wanted information on next steps with the assessment indicated cognitive impairment. 930 wanted information on how to use the assessment tools. 910 sought information how to implement these assessments in their medical practice. 880 asked which patients should be assessed. 880 wanted information on when to retest if the cognitive screen is normal. And 840 said information on how to discuss evidence of cognitive impairment with the patient would be helpful. Clearly, if such a high percentage of physicians have these questions, our healthcare system lacks standard guidelines or medical principles for assessing cognition and initiating interventions. In response to these survey results, we offer the following responses to each aspect. There are literally hundreds of brief cognitive screens available. It would be beneficial to identify 2 or 3 for physicians to choose from. Limiting the choices improves the ability of providers in various settings to interpret the results in a standard manner. When cognitive impairment is identified, next steps should be comprehensive evaluation for treatable, reversible causes, regardless of the patient's age, and a referral to a neurologist specializing in neurocognitive disorders who can evaluate for Alzheimer's disease or a related disorder. Narrowing the choice of assessment tools ensures that staff in medical offices can be proficient in administering them correctly. We now know that cognitive impairment can emerge in adults far younger than 65. While 95% of Alzheimer's disease occurs in those over the age of 65, other conditions can manifest far earlier. One example is chronic traumatic encephalopathy, or CTE, which occurs after repeated concussions. We know that football players have developed cognitive impairment and behavioral issues in their 40s, or some even younger. It makes sense to screen all adults. Screening also establishes a baseline against which problems that emerge later can be compared. If a cognitive screen is normal, cognition should be reassessed at the next annual exam, or sooner if the patient sees the physician for another health concern, or if the patient expresses a concern about cognition. Patients should be informed of the results of their cognitive screen. They should be informed about potentially treatable and reversible causes for cognitive impairment and offered screening and treatment for these causes. They should also be encouraged to seek prompt consultation with a neurologist and provided with the benefits of the earliest possible intervention if a neurocognitive disorder is diagnosed. Many patients receive no diagnosis for their cognitive impairment until middle stage of their disease. As pointed out earlier, research studies have not developed any significant treatment that all patients can safely take, or which achieve significant improvement in symptoms. The only way to identify a disease early, in its most treatable stage, is through screening, just as we do for many cancers, diabetes, high blood pressure, or others. Screening is referred to as secondary prevention, that is, the ability to catch a condition early when interventions can be most effective. Here we illustrate adding a measure of cognition to the other routinely addressed vital signs. Pain was added about 30 years ago after the American Pain Association proposed that pain was not routinely assessed and thus undertreated. The same can be said about cognitive impairment. Without screening, emerging impairment is missed. If missed, no further evaluation for appropriate follow-up, referrals, and interventions is accomplished. While one's anxiety about being screened for cognitive impairment is understandable, it is most important to recognize that the research that resulted in the recently approved medications Leqembi and Kisunla benefited only those in the early stage of Alzheimer's disease. Early stage is short and easily missed in the absence of screening. Alzheimer's Community Care will continue to advocate for medical principles resulting in standard routine screening and guidelines for thorough evaluation of symptoms, prompt referrals to specialists, and support for family caregivers. Thank you for watching this presentation. We encourage you to reach out to Alzheimer's Community Care with any questions, concerns, or for more information.